Hey everyone, and welcome back to the channel. Today we're diving into a skill that is absolutely critical for every nurse. Recognizing the early signs of patient deterioration, patient decline rarely just happens out of the blue. More often than not, there are subtle clues, early warning signs that we, as nurses, need to be able to spot. Being able to identify these signs early can literally mean the difference between life and death. So, let's explore how to identify these signs and, just as importantly, what to do about them. First up, let's talk about vital signs. This is often where we'll see the very first flicker of trouble. You need to be on high alert for things like an increased respiratory rate, a heart rate that's too fast, known as tachycardia, a drop in blood pressure, or hypotension, and a decrease in oxygen saturation levels. Even a change in temperature, whether it's a fever or hypothermia, can be a significant indicator. Out of all these, pay special attention to the respiratory rate. It is frequently the earliest and most sensitive sign that a patient is heading towards clinical decline. A small, seemingly insignificant change can be the start of something big. Never, ever ignore it. Next, let's discuss a patient's level of consciousness. A change here is a major red flag. If your patient suddenly becomes confused, unusually drowsy, agitated, or is difficult to wake up, you need to investigate immediately. These aren't just minor behavioral changes. They could signal serious underlying problems like hypoxia or sepsis. Don't hesitate to use standardized tools like the AVPU scale, which stands for Alert Voice Pain Unresponsive or the Glasgow Coma Scale to objectively assess and document their status. A sudden shift in mental state is a clear warning that your patient might be deteriorating. Another crucial sign to monitor is urine output. A significant drop in how much urine a patient is producing can be a sign of several dangerous conditions, including shock, severe dehydration, or an acute kidney injury. It's essential to meticulously track your patient's intake and output. For an adult patient, an output of less than 0.5 milliliters per kilogram per hour is a major cause for concern and warrants immediate attention. This tells you that their kidneys aren't being adequately perfused, which is a sign of systemic problems. Let's also look at the patient's skin. The skin can provide a window into their circulatory status. Be on the lookout for pale or mottled skin, a bluish tint known as cyanosis, or extremities that feel cold and clammy to the touch. These changes often indicate poor perfusion, meaning blood isn't getting to the tissues effectively. This can be a symptom of shock or other cardiovascular emergencies. A quick assessment of their skin color and temperature can give you valuable clues about what's happening internally. Now, this next one is incredibly important. Listen to your patient and listen to your own intuition. If a patient tells you, "I just don't feel right," or "I feel like something bad is going to happen," take it very seriously. Patients often have a sense about their own bodies that we can't measure with any device. Dismissing their concerns is a mistake. Your own gut feeling as a nurse is also a powerful tool. If something feels off, it probably is. Trust that instinct and investigate further. To help us put all these pieces together, we have early warning scoring systems. Many hospitals use tools like News2, which is the National Early Warning Score, or MEWS, the Modified Early Warning Score. These systems assign points to different vital signs and observations. The total score helps to quantify a patient's risk of deterioration in a standardized way. These tools are designed to catch decline early and prompt a timely response. It's crucial to know your facility's system, use it correctly, document the scores accurately, and escalate according to the protocol when a score is high. So, what do you do when you suspect a patient is deteriorating? First, don't panic. Act methodically. Go back and reassess your patient immediately. Repeat their vital signs to confirm your findings. Then, you need to escalate. Use a structured communication tool like SBA Deterioration, background assessment, recommendation to clearly and concisely report your concerns to the provider or charge nurse. If your hospital has a rapid response team, don't hesitate to call them. That's what they're there for. And throughout this entire process, document everything clearly and precisely. Early escalation is what prevents a crisis from turning into a cardiac arrest. To wrap up, recognizing the early signs of patient deterioration is a fundamental nursing skill that we must continually sharpen. It's a combination of sharp observation, critical thinking, and, most importantly, swift action. Mastering this doesn't just make you a better nurse, it saves lives. If you found this video helpful, please give it a thumbs up and subscribe to Oxford Nursing Education for more professional insights and practical tips. Thanks for watching, and stay safe out there.